So let's go to some of the clinical phases of impaired bioenergetics. So here's a scenario. Let's say a 34-year-old lady, never been able to recover from my car accident. I have fatigue is one of the chief complaints. So why isn't the patient able to recover? So maybe the extent of injury wasn't even as severe as other people you may have worked with or that are out there after some kind of trauma. But some people cannot recover. One of the key things you need to have for recovery is healthy bioenergetics. Or here's another person with fatigue, depressed all the time. There's an intimate relationship between the frequency of firing of your prefrontal cortex, limbic system, and your mood. So when brain energy levels go down, one of the immediate chief complaints is decreased mood, not ability wanting to do anything, dopamine levels go down, bioenergetics, neurotransmitter activity, they all go down. And one of the consequences of decreased mitochondrial function, decreased ATP in the brain is really depression. And we'll show you a bunch of research with that throughout the course. Here's another scenario. A person with fatigue. I'm tired all the time. And when I exercise, my body hurts for days. And there's people, when we went to the diabetes course, we talked about the difference in mitochondrial function in diabetics and people that have obesity compared to normal population. They just don't work as well. We'll also talk about people that have what's called chronic fatigue syndromes. They call it, or fibromyalgia patients, where they actually have deficits in their mitochondrial function. Here's another scenario. I've been able to recover from my Epstein-Barr infection. They're chronically sick. They develop autoimmune diseases. We all see these types of patients in our practices. Or they cannot function in the morning. My muscles are always tight. They just don't feel right, but they're young. They don't know what's happening with them, and they have fatigue. Or a person who just is wiped out. And they're healthy. They should be healthy. They're young, tired, their brain fog, their body hurts. They have a huge list of labs. They've been everywhere. They don't know what else to do. They haven't been diagnosed with the disease, and they're frustrated. So these are the phases of impaired bioenergetics. These are the types of cases that the information we're going to discuss in this course is really going to go into. Now, ultimately, when you look at bioenergetics, you're also looking at mitochondrial function. So at the end of the day, when we look at all the different variables, there are some things that disrupt mitochondrial function and there's some things that activate it. And then people who are not producing energy may have a combination of both. They may be exposed to lots of things that disrupt their mitochondria, and they may not have enough variables in their diet and their lifestyle that are impacting activation of their mitochondria. And when this thing shifts, where there is a decreased potential to make ATP, this is when we see all types of clinical presentations. And ultimately, when you look at people that have fatigue, sometimes they have a medical condition that's causing it as part of the big picture, and sometimes they just have physiological mechanisms that aren't really disease, but they really impact how energies function. For example, medical conditions like anemia, hypothyroidism, or diabetes, or autoimmune disease, or pulmonary disease, or any kind of disease of the organs, they're all going to cause fatigue. But then we have conditions like just insomnia, or dysglycemia, or sedentary lifestyle, or just chronic inflammation, or multiple food sensitivities, or chemical sensitivities, or lots of oxidative stress that can also cause fatigue. And realistically, with many chronic patients, you have a kind of overlap with both those things. And that's what you have to kind of navigate and work yourself through as you go through the process of trying to optimize their bioenergetics. Now, here's a list we're going to go through step by step in detail later on throughout the course. But I just put together on the left-hand side disruptive bioenergetic factors, things like toxins, chemicals, infections, hypercaloric diet, stomach inflammation, a drug-induced mitochondrial injury, dietary protein inflammation, and the things that support the mitochondria. Healthy delivery of fuel, glucose, ketones, oxygens, antioxidants, mitochondrial metabolism, physical activity, cognitive activity, hormone activation, mitochondria, bioenergetic nutraceuticals, sleep impact on mitochondria, circadian rhythm impact on mitochondria, periods of restricted feeding. And I will tell you that before we go any further, this is not a nutraceutical game. You're not going to just put people on bags and bags of supplements and they're going to recover. As a matter of fact, most of the patients that you see in a real clinical scenario are coming in with bags full of supplements. What's happening is they're not getting the underlying physiological mechanisms identified and then doing strategies to address that. They're hoping they can supplement their way out of it. And with many of these bioenergetic issues, you cannot do that. You can always use it as an adjunct therapy to help you address the goals specific to what mechanisms you find. But it's not something you're just going to take some magic probiotic or some magic energy drink and everything's going to get better. It just does not happen. Okay, Now, when we look at chronic fatigue, ultimately, we're looking at all the variables that support energy production, energy factors, and all the things that are disruptive. And then an individual person with chronic fatigue may have, for example, they just don't move anymore. They have no physical activity. So if you don't have physical activity, you don't make mitochondria. It's that simple. One of the most important things to help you make energy is to actually move. And as you move, you make mitochondria. So as soon as people become sedentary, you just say goodbye quality of life, goodbye health. Because lack of movement is going to impact mitochondrial development. They may not sleep well. They may not have proper circadian rhythms. They have some blood sugar issues. They have some dietary protein inflammation. They're sensitive to gluten, dairy, soy, some of these foods. You combine some of these basic things together, you get a person now with chronic fatigue. They walk into the healthcare system. They don't have disease. They don't have pathology. They're tired all the time. They know there's something wrong. They don't feel well. They can't do all the things they want to do in life. But this is a combination of many physiological mechanisms that cause fatigue. You get another person that's fatigued, and they have anemia. They actually have a disorder. They have a medical condition. Their red blood cells cannot mature. They're deprived of something that the red blood cells need. Maybe it's iron, maybe it's B12, maybe it's other factors that impact the health of the red blood cells. But you could have a person that just has something like anemia. Now, here's a question. Why would some patients with anemia be completely exhausted and others with the same severity of anemia not have the same drops of energy? Sometimes you look at a patient and you look at their lab work and they have extreme anemia and you go, how do you feel? They're like, I feel great. You have anemia. And they're like, that's not possible. I just worked out today. I'm an avid runner. I don't think this lab test is accurate. And let's run it again. You run it again. They still have anemia. And another person come in and they have a slight bit of anemia and they're exhausted and they can't function. They can't get out of bed. So why is that? The reason that is because it's not just one thing that impacts energy function. So maybe they don't have as much red blood cells carrying oxygen to the mitochondria, but maybe the mitochondria that have fused together and they've enlarged and they adapted and they're making more mitochondria to compensate for their anemia. So for them, they're totally fine. Another person could have anemia and they also have, let's say, chronic blood sugar issues, or they have chronic insulin issues or chronic inflammation. So their ATP combined with other factors that impact bioenergetics really impact how they feel and function. So key concept, in order to find clinical strategies to improve ATP output, you need to first understand cellular bioenergetics and what specific mechanisms optimize bioenergetics and what mechanisms disrupt them. And we went over those. For this short list here, we're going to get into that with much more detail. But ultimately, you have to make mitochondria. The mitochondria have to fuse together and get larger for better function. They need to be protected because as you make energy, you also make free radicals. And then reactive oxygen species can impact injury to the mitochondria. And then once ATP is made, there's some damaged mitochondria. They have to be broken off. That's called fission. And then the mitochondria have to be cleared. If these things are not working properly, then you can have disease promotion and low energy. Now, if you optimize bioenergetics, then you can have different types of changes and different types of outcomes as we go through each of those individual mechanisms. So now let's go over some of the key concepts of bioenergetics. So for some of you, I know we've all studied the mitochondria. I need to get into it with a little more detail and I need to make sure everyone has the same review. And I want to make sure that everyone understands all the different mechanisms involved with mitochondrial function because they do have a clinical relevance. So even though I'll review like mitochondrial basics, I will try to make the link with you for clinical applications here. So hang in there with me as we go through this section. So let's first of all talk about endosymbiosis, which is important. One of the interesting things about endosymbiosis and mitochondrial theory is, first of all, let me define what endosymbiosis is. Endosymbiosis is one living organism lives in another living organisms. So the interesting thing is that when you look at mitochondria and cells, the theory is that they were really a combination of these prokaryotic cells, these bacterial organisms without nucleus cell membranes, then coexisting within eukaryotic cells with nucleuses, whereas this one's DNA is not in the nucleus. And the integration between these bacterial cells within living cells really created mitochondria. And these mitochondria really have this physiological cellular development from actually bacteria that is involved with making energy. Then living within each other is whereas the bacterial mitochondrial organism gets fuel and substrates from the prokaryotic cell, then feeds the eukaryotic cell, creates a cycle. We have lots of energy. And the reason why this is important for us is because there are different types of reactions that take place in different types of diseases. And the key thing to understand, and the reason I want to share this with you, is there's different DNA in the mitochondria than DNA in the nucleus of the cell. So there's two different types of DNA. And the DNA within a mitochondria is called mitochondrial DNA. And normally as we go through cell replication, cell generation, we'll have some degree of mutant, unhealthy mitochondria. And then when people have different mutations in their mitochondrial DNA, they can end up with really inefficient mitochondria. And this can lead to different types of diseases. And when I look at mitochondrial dysfunctions, we have inherited mitochondrial diseases and we have acquired mitochondrial diseases. So if we look at the inherited mitochondrial diseases, these are mutations in mitochondria DNA, different than the nucleus and enveloped DNA. And these could be different types of myopathies or different types of neuropathies. And these types of genetic DNA, they don't respond to diet, nutrition, lifestyle. You need to know those. Because you may have a patient that comes in with a mitochondrial genetic disease trying to do something with diet, nutrition, lifestyle, and nothing's going to happen. If you, as a practitioner, don't understand that, and you keep working with those types of patients, you will completely burn out. There will be a point you don't want to practice. And especially as you get better and better with functional medicine, you get more and more referrals, you'll start to see lots of chronic patients that people are confused with. They go, you try something, we would try everything else. You need to know your model may not work for them either. I can tell you this, just recently I had one patient in the past 2 years, one person referred to me 5 different times. And we looked at the case, she's got a mitochondrial disease that's causing there's nothing functional medicine can do for that. And they go, oh. And what's shocking about that is how many practitioners don't understand that concept. The treatment approach we have in functional medicine doesn't work for all types of things. And maybe in the future, as they work with gene therapy and CRISPR and all the different things that are becoming breakthroughs, they'll have some hope. But beware of difference between inherited mitochondrial diseases. These will usually be like your full-blown degenerative neurological diseases, degenerative muscular diseases, and so forth, that they really have a DNA origin. Not to say you can't do things to improve the quality of life and health for what they have, but don't expect to see major changes with those types of outcomes. For the most part, our course and our focus will be on acquired mitochondrial dysfunctions. We're not going to deal with inherited mitochondrial diseases. And these are induced by the environment. Your sleep, your diet, your lifestyle, medications, chemical exposures, they all have an impact on these mechanisms. And when acquired mitochondrial dysfunctions become disrupted, that's when you can get things like chronic fatigue syndrome. That's when you can get sarcopenia, neurodegenerative diseases, and early aging. So these types of acquired mitochondrial dysfunctions, there's a lot that can be done with functional medicine. There's a lot that can be done with diet, nutrition, lifestyle. So this is really important as we move on.
Start your 7-day free trial at KarazianInstitute.com if you're a licensed healthcare practitioner ready to evolve your functional medicine practice. Explore over 300 hours of clinical training, masterclasses with leading functional medicine clinicians, and certification pathways. Or check out the Academy of Functional Nutrition and Lifestyle Medicine at AFNLM.com. Whether you're on the path to certification as a functional nutritionist or simply want to optimize your own and your family's health, our skill-building approach builds real-world competence from the ground up. And lastly, if you're dealing with chronic health challenges, visit drknews.com for self-paced courses that help you understand and address fatigue, brain fog, autoimmune conditions, gut problems, and more using evidence-based approaches. The content on this podcast is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult with your healthcare provider before making any changes to your health regimen. Thanks for listening, and don't forget to subscribe and share with someone who might benefit.